I'm sorry. Which item number? What's the item number for Bell? 8?
It's 8.
8. So I'm sorry, Senator Leno's going to allow Senator Bell, item number 8, SB 326, courts, penalties, emergency services funding.
Yeah.
Please step forward.
Thank you.
Welcome, Senator.
Okay, I'm going to go quick because I know you guys worked real hard today. Good afternoon, Mr. Chairman and members. We're presenting SB 326 related to emergency services funding for air ambulances. Little history here. In 2010, I authored AB 2173, the Emergency Medical Air Transportation Act, also known as EMATA, that's our initial. The law placed a flat $4 additional penalty on vehicle code violations. The penalty was collected and used to fund Medi-Cal services specifically for air ambulance services, and drawing down federal matching funds. Air ambulance helicopters provide life-saving emergency transportation to the most critical patients on the regional basis, crossing county lines on a majority of their flights. Now, prior to this bill, AB 2173, the Medi-Cal service fee schedule paid ambulance air services far below the cost of providing air transportation and was paying nothing if the patient was an indigent. So this bill, AB 2173, ensured providers increase in sustainability and getting reimbursed for Medi-Cal, because before they didn't have any Medi-Cal reimbursement. So this bill, SB 326, all it really does is simply maintain the current level of Medi-Cal funding for emergency air ambulance transportation by removing the 2016 sunset clause on the law. I'll turn it over to my co-sponsors and allow you to ask questions.
Thank you, Chairman and members of the committee. My name is Bill Bryant. I represent the California Association of Air Medical Services. And just to highlight what Senator Bell has brought to you, the entire purpose of the bill was simply to provide an increase of Medicaid funding to private air ambulance services who rely on billing and collections from each individual patient in order to remain viable. Private air ambulances receive no tax dollars, no tax support, and we get no funding when we transport indigents or anybody without insurance. So we rely entirely on each bill to get paid. Medicaid pays us a fraction of what our bills are and what our costs are, and the EMATA bill has made that at least bearable. It brings it up to close to the Medicare rates, which is what we're asking you to continue. And I'll turn it over to CalStar.
Good afternoon, everyone. My name is Lynn Malmstrom. I'm the president and CEO of CalStar, California Shock Trauma Air Rescue. CalStar is a nonprofit community benefit ambulance provider. It's based here in Sacramento. We operate 14 helicopters and 2 fixed-wing aircraft covering all of Northern and Central California from 9 operating bases stretching from Ukiah south through Monterey County to Santa Maria, Oakland, and east to South Lake Tahoe. I would first like to thank Senator Bell for being our champion 5 years ago and getting this bill passed. We do not receive any tax support, and we must bill Medicaid or any other insurance that might be in operation to cover every person that we transport, and many people we transport without any reimbursement at all from any source. While the enhanced Medi-Cal rates do not cover our full cost of providing the service, it's a huge improvement. And the continuance of these rates quite literally can make the difference between keeping our more rural, lower flight volume bases sustainable. As you can imagine, this provides access for those people that probably need that most. As you might guess, our operating an air ambulance is very, very expensive with significant capital investment and continue with high fixed costs of operation. Each of our helicopter bases is staffed 24/7, 365, and are staffed with 4 pilots 8 critical care registered flight nurses, and at least 1 dedicated mechanic for each helicopter. The average base has a fixed cost of about $3.3 million per year. A new EMS helicopter for CalStar costs us approximately $6.5 million, excluding the continued investments and costs related to patient crew safety and additional equipment needed to ensure that that is the case. For these reasons, CalStar is asking for your support for this bill.
Catherine Oscar-Scott, representing both the air ambulance industry as well as the California Hospital Association in support.
Chris McKaylee, on behalf of the California Ambulance Association, we support the measure on behalf of our air ambulance members.
Thank you. Anyone else in support? Please state your name and position only.
My name is Rocky Allen. I work for Mercy Air. I'm in Southern California. I live in Garden Grove. Please support SB 326.
Thank you.
My name is Bill Baker. I work for all 11 bases with Mercy Air throughout California, live in Rancho Cucamonga, and I support Senate Bill 326.
My name is Bill Tripp. I'm a flight paramedic with PHI Air Medical. I live in Merced County. I am based in Modesto, Stanislaus County, and service the surrounding counties. Please support SB 326.
My name is Mark Isbell. I'm chief pilot for CalStar. Work out of Sacramento. I live in Folsom, and I'd like you to support Senate Bill 326, please.
Hi, my name is Lori Hines. I'm the clinical nurse educator and flight nurse with CalStar Air Ambulance. Please support SB 326.
My name is Erin Cox. I'm the operations manager for PHI Air Medical. It services the northern and central state. Please support this bill.
Thank you. Any opposition?
Good morning, sir. Good evening, Mr. Chairman and members. Lieutenant Wayne Billowit on behalf of Los Angeles County Sheriff's Department. We do not have an opposition to the bill. We have some concerns. We're trying to work with the author. We have tremendous respect for the men and women who do these missions. However, the law as currently permitted does not allow for public agencies that perform the very same tasks as these commercial agencies do to obtain any money from the fund. And that's simply because it's intertwined with the Medi-Cal reimbursement. In Los Angeles County, for an instance, we use a triad of services to provide these air flights that include the LA County Fire Department that does over 1,000 a year, the LA City Fire Department, and the LA County Sheriff. We primarily use public agencies instead of private. We don't, even though the fund is created off work done by public agencies cannot obtain any funding from this fund to help offset our costs, which are high as well. So anyways, we like to continue to work with the author. We understand this fund is important. We're very supportive of the fund, but we just want to see if there's a way that perhaps public agencies, such as the Highway Patrol in the state of California that perform the very same functions as the commercial air carriers, can perhaps get some sort of reimbursement off the fund as well. So we thank you very much for your time. Thank you.
Thank you. Anyone else in opposition or concerns or comments? And just to address the comment and concern, is Senator Bell willing to address or work with the LA County Sheriffs?
Yeah, we've been willing to work with them, other agencies. This is, of course, understanding the money that is collected with this fee is not for law enforcement per se, it's for health care, transportation only. And so that could be an issue with how the billing takes place on that, but we can discuss that with them.
Okay.
If need be, we might want to have to look at some other separate legislation on that to deal with that.
Okay. Well, I'm prepared to support it in its current form. You know, the author's committed to at least looking into it and possibly working something out. Is there a motion? Yes, question. Senator Nielsen.
If you don't have a motion, I would make one. But I would have to observe, representing 19 different counties over the years, the value of what these folks do. In the many rural areas, and many of those 19 counties are rural areas, people avail themselves of the services. And I have been on the scene to see what they do. It's a tough business. And in many areas that I represent, the emergency responders are the only health care people get. Now, maybe not to this level. This is more critical in transport, but I've also been at hospitals at nights when you hear those copters coming in all the time. But most particularly, I envision the scenes of them responding, pouring out of those copters and coming onto the scene to see what they have to contend with. But more importantly, what they do and the lives they protect, and the hope and the confidence that they give in other people who are just wanting to avoid situations, but knowing if something happens, these folks will be there for them.
Seeing no other comment, I believe there's a motion by Senator Woke. Is that correct? Or Senator Roth? Roth moved the bill. Any other comment? Would you like to close?
Yes, I think if the bill doesn't pass, simply a lot of the air ambulance services will not exist. And ayers and I vote, this helps sustain over $10 million in federal matching funds, so our support.
Thank you very much. Chair's recommending an aye vote. This is item number 8, SB 326. Do pass 2 appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning.
Aye.
Monning, aye. Nielsen. Nielsen, aye. Pan. Roth.
Aye.
Roth, aye. Wolk. Wolk, aye. 5.
Currently has 5. We're going to put that bill in call. I believe Senator Leno is going to allow Senator Mendoza to present item number 10. Thank you very much, Senator. You're very kind to do so. Incredibly gracious. Item number 10, SB 476, organized camps. Senator Mendoza, please proceed.
Thank you, Mr. Chair, and thank you, Mr. Leno, for allowing me to come before you. I'm here to present SB 476. I would first like to begin by thanking the committee staff for their work on this bill and accept the technical and clarifying amendments on page 4 of the committee analysis and the amendments to clarify the definition of organized day camp to exclude programs offered by sports training organizations. A mock-up of these amendments are being passed out as we speak. SB 476 will ensure that day camps meet the same standards as residential camps, including oversight by the local health department and the local fire marshal. In addition, this bill requires that carbon monoxide detectors be installed in camp buildings. Here to testify with me today is Catherine Barankin with the California Collaboration for Youth and Michelle Branconier with the American Camp Association.
Thank you, Senator. Mr. Chair, members, I'm Kathy Barankin with the California Coalition for Children, California Collaboration for Youth. And in reference, or deference, I should say, to all of the time you've already spent in committee today, we'll be very, very brief. Michelle Branconier is with the American Camp Association. Glenn Robeson is with Guided Discoveries. And then we'll be available to answer any questions you have.
Thank you very much. I believe we have support on both sides. Please state your name and position.
Michelle Rankinier, I'm with the American Camp Association. We accredit more than 300 camps in the state of California, both day and resident camps. We are strong support of this bill.
Thank you.
Thank you.
My name is Glenn Robison. I represent Guided Discoveries. We serve over 50,000 school kids each year at our 4 summer camps and school programs during the school year.
Thank you very much. Anyone else in support?
Chris Lepp Twombly with the California State Alliance of YMCAs. We run about 115,000 camp placements each year. We're in strong support of the bill. Thank you.
Thank you. Any opposition? Questions, comments from any of the members? Do we have a motion? So moved by Senator Woke. Chair's recommending an aye. Would you like to close?
Respectfully ask for your aye vote, Mr. Chair.
Thank you very much, Senator. This is item number 10, SB 476. Is due pass amended appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning.
Aye.
Monning, aye. Nielsen. Nielsen, aye. Pan. Roth.
Aye.
Roth, aye. Wolk.
Aye.
Wolk, aye.
Yeah, currently has 6. We're going to place that bill on call. Now, I believe we're going to go to item number, Senator Leno, we're going to go on your item? Yes. Item number 4, SB 140.